You've been seeing all of the AI headlines. What can the technology mean for your health? Welcome back to What's Next? Living Longer, Better, Smarter. In this edition, can AI save your life? First, this message. This episode is made possible by Eugeria, improving the quality of life for older adults and people living with dementia. Eugeria offers a carefully selected, science-backed range of products designed to simplify daily life, promote independence, and enhance well-being. From everyday essentials to support autonomy, engaging activities for cognitive stimulation, and care solutions for comfort and safety. Discover the curated catalog at eugeria.care. I'm Fred Fishkin, along with Mary Furlong. Hi, Mary.
Hi, Fred. We have some amazing guests with us today, talking about issues that are so important.
We really do. We're going to talk about what AI can mean for healthcare and even what it can do to help insurance claim appeals. Stay tuned for that. First, we want to welcome Dr. David Rhew, Global Chief Medical Officer at Microsoft. It's really great to see you again, David.
Thank you, Fred. Mary, it's great to be here.
David, we're so appreciative of you spending time with us on the podcast. You know, the subject of AI can be confusing and sometimes frightening to many people. We're seeing the phrase AI everywhere. How is this so different from healthcare professionals using computers and searches online, the kinds of things that have been going on for years?
Yeah, that's a great question. And maybe the best way to answer that would be to talk about how AI has evolved. And if you think about when the term AI was first coined, it was in the 1950s. It was essentially referring to a computer acting very much like a human. And back then, there really wasn't as much of a vision of how this could happen. But as AI matured, and more specifically, as we began to develop what's called machine learning, where we'd learn from the data, it could potentially go beyond simple algorithms to become much more forward in its thinking. And it could do some amazing things as we started developing some of the computing capacity that surrounded the AI. So for instance, beating chess champions or world chess champions, beating world Go champions. But one thing that really has developed over time is the fact that it's also taken on this other very human-like characteristic, which is the ability to understand unstructured forms of data. So for instance, voice, text, video, images, these are things that traditionally a human could only do, but now the computer can do that. And then now you've added on top of that an ability for it to be able to learn and anticipate what that next word or pixel is. And in that way, this new generation of AI is called generative AI has emerged. And it does three things really well. It can find information from all these different sources. It can synthesize it into things that are understandable, and it can present it in the right formats, whether it be in the form of a note or even the form of code. And collectively, all these elements of AI can do things very similar to what humans and human experts have done in the past. And this is both exciting, and for some people, it is a little bit scary because they're starting to realize that maybe their jobs may be impacted by the fact that AI could potentially be applied and do things better or more efficiently than them. But I think that's actually probably maybe the wrong way to think about it, because in large part, what we're finding is that AI can be an incredible augmenter. It can augment our capabilities. It can expand our capabilities. And we find that we don't have enough human resources and experts in areas, but it allows us to be able to scale that.
Really using this as a tool, I suppose, or tools. So what role are you and Microsoft playing in bringing these tools to medical professionals?
Well, the first thing we're doing is we're trying to help accelerate the process. So we know that many organizations today are looking at AI and trying to understand how can we apply it within our own settings. And one of the things that we have been understanding is that there's a lot of reinventing of the wheel. And so if we can somehow accelerate that by creating what we call foundation models, and oftentimes incorporate some of the more complex activities, such as creating these multimodal embedding models, which essentially means that we're going to try to create something that they can leverage as they continue to build their models. That's like the first thing that we're doing. But I think the second thing that's just as important is we're focusing on how to apply AI responsibly. And it's not just within Microsoft, but also working with partners across the entire healthcare ecosystem that allow us to be able to know what does it mean to apply AI responsibly, have some transparency in terms of the process, understand whether or not these models have been tested on local data sets, monitored for outcomes, and monitored for drift. And there's a variety of other things that are important, but ultimately this has to be done in a collaborative manner with multiple stakeholders.
And you've been creating some partnerships. I think you have a new one with Duke.
That's right. And that is one of the partnerships that relates to responsible AI. It's called the Trustworthy and Responsible AI Network, or TRAIN. It was launched in the US, but it's also been launched in Europe as well. We have about 50 sites in the US, health systems, academic medical centers, health systems that are rather large. We've got small community, rural hospitals. So it really goes the whole gamut. And part of what we've tried to do is we've tried to make implementing responsible AI as if time, cost, and resource efficient as possible. And that means leveraging technologies, leveraging collaboration so that we can actually redistribute some of the workloads related to testing and monitoring, and also figuring out new ways that we can partner together to be able to help some of the lower resource settings be able to do this as well.
So what is the potential here to really change the face of healthcare and improve outcomes? I heard about a breast cancer company that was just funded.
Yes, I mean we're talking about so many different areas and ways that AI can be applied, but I think perhaps maybe one of the most exciting things is that we may be able to change the whole concept of how healthcare is delivered, and in that we have to require individuals to come into a clinic or to come into a hospital to be seen. We now have an ability to be able to then extend our care outside of those facilities in ways that we could never have done before. So in September of this past year, I had the opportunity to co-chair an event with multiple stakeholders, and we launched something called the Alliance for Healthcare from the Eye. And what it is essentially is applying AI on retinal images that are obtained during a routine eye exam. So every one of us has had these eye exams where you put your chin on the machine and you have these lenses that go across, and you're asking, is it better or worse? Well, now what we're doing is we're taking those images with the patient's permission and running AI on it to make diagnosis or at least identify conditions that could potentially need to be treated. And we're starting with diabetic retinopathy. Now, this is something that there's been over 21 studies that have shown that it's a highly sensitive, highly specific type of a model. Just give you an idea, the sensitivity is 91%, the specificity is 88%. Relative to a human, which is the benchmark is around 80%, it's doing very well. And we now have the ability to automate the data capture where we could actually have don't require a physician or a clinician to be able to then perform the examination or even have a technician, but this can be completely automated, which means we could bring this to clinics and other facilities outside of their eye care center. It could be primary care. It could even be in retail or malls or kiosks. And so this can change the whole paradigm, specifically in rural America and other parts that are underserved. And what's extraordinary is we may also be able to then extend that beyond diabetic retinopathy to include cardiovascular, hypertension, a whole bunch of ophthalmologic conditions, and even neurovascular conditions like Parkinson's and MS and Alzheimer's. So extraordinary. I mean, we can completely change the way that we think of how healthcare is delivered.
Are there some areas of medicine where we're seeing a lot of impact from AI right now?
Oh, yeah, absolutely. So what I've shared with you is something that is right around the corner, but right now we are already seeing AI being applied in ways that will improve the lives of clinicians. As you're probably well aware, almost 50% of clinicians are burned out, largely because of the administrative work that they have to do. Documenting into the EHR is one of those things. And with a voice conversation that a patient and a clinician can have, that conversation could be converted into a clinical progress note. essentially something that the clinician normally has to type into the computer. But it's already, as soon as you're done with the conversation, it's not only transcribed, but it's organized into the structure that a clinician would typically use for their note. And with a few edits, you push a button and it, boom, it's in the system. And that's extraordinary because it decreases the amount of time clinicians have to spend documenting into the EHR by at least 50%. It improves patient satisfaction because you're not looking at the clinician's back anymore. And it's been used in many settings across smaller clinics to larger clinics. And so it's really a great opportunity for us to start thinking about how AI can have that immediate impact on our interactions with clinicians.
So can individuals use AI to tailor their own personal health journey, can maybe with diet and exercise?
Well, that's a great idea. And in fact, that's something that I think hopefully in the near future, we're going to see some of these models very mature. So if we start with things like chatbots have gotten a lot better. And with the generative AI, they are becoming much more capable. And if we think about the chatbots then connecting to other, what we call agentic AI agents, which are essentially agents or AI models that will do certain tasks, we can envision a world where we have these personal navigators, where the chatbot is something that that really understands you, your insurance, understands your medical condition, understands all elements about you and your preferences, and can help you navigate these complicated systems. That's something that would be extraordinary and would allow us to be able to then empower ourselves with the knowledge and the capabilities to be able to make smarter decisions and ultimately lead to better health.
What about safety and security? People worry about AI getting out of control or those hallucinations that we've all read about. I mean, there's a lot of clickbait, but there are also, I guess, some legitimate concerns.
Absolutely. I mean, none of these systems are 100% perfect, but at the same time, they are oftentimes many times better than what we currently have today. That said, we need to think about ways that we can, continue to focus on improving safety. And there's several ways that we can look at it. First, as we develop these models, we can do things such as, and specifically this applies to generative AI, we can take documents and we can upload them and have the generative AI refer to those documents and only focus on what's in the document. So it's something called retrieval augmented generation, or RAG architecture. And we can also have the AI and ML QA itself. And so that also is sort of an approach as before we deploy it. There are also safeguards that can detect hallucinations that could be used for both QA and also for deployment. There's strategies for how we can actually apply it. So choosing the right use case, making sure that we're focusing on things like triage and not just on real-time decisions that have to be done by a clinician. Bring the human in the loop. And then monitoring, making sure that we're monitoring for the outcomes post-deployment. And these are all ways that we can improve the overall safety of not just AI, but really all technologies. But this is something that we feel is important as we deploy AI so we can continue to foster trust in it.
So I think I know how you would answer our opening question, can AI save your life? Tell us what your hopes are for where this technology will be and the impact it will have if we look ahead. I know that can be difficult sometimes, but if we look ahead 5 or 10 years when it comes to healthcare.
Yeah, well, what do they say? That predictions are difficult, especially when they involve the future. Well, I would say that for now, one of the things that is most exciting is that we are seeing that AI could change the whole paradigm of access to information and knowledge and allow us to be able to do things that normally speaking could only have been done by an expert. In many cases, those experts are in health systems with limited number of resources. We may potentially be able to democratize care for anyone everywhere globally. Starting in the United States with people that live outside of the reach of and are maybe not as in contact with their clinicians regularly. So these are folks that could be in rural America, but also in other countries where we find that perhaps care may not need be as available, readily available for these individuals. So I see great opportunity for everyone, but most specifically the gaps where we have the largest opportunities may be in those that are with individuals that are the least have the least access to care, are underserved and vulnerable.
This is really fascinating. I'm so glad you joined us today. Where can our viewers and listeners go for more information, Dr. Rhew?
Well, there's so many sources today. I would say oftentimes finding a trusted individual, on a LinkedIn profile and following them. There are many resources that are available through institutions. LinkedIn has a whole set of learnings on how you can actually get trained on using AI. Microsoft has a whole series of programs. One of the programs that I'm particularly excited about is something called a Promptathon, which is a one-day session where people learn how to do prompt engineering, and it greatly accelerates people's ability to use these generative AI tools and not just simply think of them as a search engine, but as an assistant that can help them answer many problems.
Love that idea. I'm going to add a prompathon to my spring training this year. David, congratulations on the work that you and your team at Microsoft are doing. Thank you for being with us, and we look forward to more updates in the future. Great to have you with us today.
Mary and Fred, as always, a pleasure. Thank you for having me.
Mary, there really is a lot to look forward to. AI tools are already having an impact, and our next guest is really on the cutting edge. Neal Shah is not only the founder and CEO of Care Yaya, he is also now co-founder of Counterforce Health, and it has AI at its heart. Hi, Neal.
Hey, Fred. Hey, Mary. Thanks for having me on.
Neal, you continue to amaze us. We're going to talk to you about the progress of Care Yaya, but first I wanted to hear all about your new venture. What is it?
Sure. So I'll just start off with saying 850 million healthcare claims are denied every year in America. It's a shocking, shocking magnitude of a problem. 1 in 5 Americans who has health insurance has been denied a claim in the last year. So it's a really societal crisis, and I think as highlighted by the United Health tragedy that happened a couple months ago, and I think digging beneath the surface, it came to the forefront that a lot of people are dealing with these denied claim issues. I've been in this situation myself, actually. During my wife's cancer care for several years, we had so many claims denied, and just kind of when you're in your darkest moments, you're spending hours and hours fighting these, writing detailed letters, fixing billing codes, et cetera. So, I thought that there was a huge use case here to build AI to help people navigating this process. The statistic is actually shocking. Out of those claims that are denied, less than half, less than 0.5%, so 0.5% of those denied claims are actually appealed. But up to 75% of appeals are actually successful. So can you imagine the unmet need of tons of people and $250 billion of claims annually are not being appealed? And if you could build AI tools to kind of empower people, whether it's individual patients or even small clinics and physicians, to start just appealing a lot of denied claims, you'd have a pretty high win rate, and you'd get a lot of people, their money back for things that they're rightfully owed. So I think it's like a huge societal crisis, and I think in many cases, because people get these claims denied, they don't get the treatment they need, or they go into major financial problems, and medical debt is a rising problem in society. 60% of bankruptcies are caused by medical debt. So I think there's a huge unmet need and a huge opportunity. So over the last 2 or 3 months, we were sprinting while running Care Yaya on building Counterforce Health. We built a suite of AI tools that it would be as simple as, let's say you got denied a $500 blood test that you did, and you have a claim now that isn't paid, and you're going to have to pay it out of pocket. Just go to our site, upload your denial letter, upload any backup documentation, and within 2 minutes, a very detailed, personalized appeal letter is crafted for you that we've had several doctors use. It's better than what a doctor would spend 2 to 3 hours writing. And for the average person, they wouldn't even have a chance of writing something like this. And the system has learned a lot from processing through thousands and thousands of case studies on how to kind of appeal. So that's done for you in a couple of minutes. And then the next tool that we're building and we're prototyping beta testing is a full voice AI agent that will call the insurance company on your behalf and deal with the claims and billing department and talk through the issue and get your claim paid. So yeah, pretty cool.
We have to get the word out about this. This is really
Thanks.
important.
Thanks.
I know you've been so busy growing CareYaya, and I love all the CareYayas. So tell us, how did this come about?
Yeah, this came about actually, I think, from both the personal journey that I've experienced with claim denials. I think just like it kind of like becoming a societal topic. And then after that, hearing from several of the families on the care platform. Older adults experience unbelievable rates of claim denials, by the way. Like as a lot of the health insurance for the above 65 crowd has shifted from Medicare traditional to Medicare Advantage, right? Like now more than half of Medicare is administered through private Medicare Advantage plans. Some of the claim denial rates are like unbelievable. I mean, there have been articles on this, right? It's because the insurers are using AI. So United Healthcare, in one of their Medicare Advantage plans, had a 90% claim denial rate for certain things that people needed in assisted living facilities and nursing homes. So, when you have like those kind of denial rates, if you think about it from the insurer's perspective, they're capitalizing on the fact that the average person is going to be intimidated, not know how to navigate this stuff, and by throwing up roadblocks, they'll just be able to kind of collect extra income. So I think that I mean, the problem of claim denials affects everyone, but think about who in society utilizes healthcare the most, older adults, and who has now been shifted in the last decade from traditional Medicare, which doesn't have nearly as high of claim denial, to now private for-profit insurance, Medicare Advantage, older adults. So claim denials rates are sky high. And then you think who's least likely to appeal? Also older adults. So you got to make it as easy for them as possible. So I think we're incubating as a separate startup because I think there's a broader market beyond just older adults, but it was initially just inspired by people using our platform and seeing how much of a pain and problem they were going through. And for many people who are like on fixed incomes, it's a financial disaster because you need healthcare, you are getting claims denied, you might be going into debt for post-care denials, and you might then start limiting your interaction with the healthcare system because you're scared of all the unexpected bills. So I feel like you need to build tools to have people feel like they have rights.
Right. And I don't care how much money you may have saved up for retirement and think you're okay. A medical situation can deplete that very quickly if you're not getting claims approved, right?
I mean, I'll tell you, one of the people using it is a retired doctor. And it's like we've been helping him a bunch. He ended up getting a pretty bad bout of COVID about 2 years ago. Hospitalized, $1.5 million of claims on aggregate that were denied. Good insurance too, right? I mean, it's just a financial disaster, right? Just like all the money would be wiped out. So has like been spending years fighting all this stuff. And I mean, that's an extreme example. And then you have everything from that to people with a $800 claim, $1,000 claim, $5,000 claim. So you have kind of this wide spectrum of things that the denial rates across America have skyrocketed. And I think I did a ton of research on this and was like really writing a lot on this, that 10 years ago, most large insurance companies had about a 1 to 1.5% denial rate. Today, it's between 15 to 30%. So it's gotten unchecked now. I think partly due to like lack of regulatory action, partly due to a series of mergers and mega mergers, and then partly due to the insurers incorporating AI on their end to just programmatically deny stuff. But when you have like United, you have pushing a 30% denial rate, but even other plans, Cigna, Humana, you have like 15 to 20% denial rates. That's millions of Americans dealing with this now suddenly. And when you talk to physician practices, a lot of the geriatric physicians we talk to, neurologists, et cetera, they're saying to their practice, it's become an epidemic in the last 2 or 3 years, that they're complaining about it because these denied claims, oftentimes the underlying people don't pay, and then the clinic has to take a write-off. So it's become a financial issue for the clinic too. So yeah, it's a disaster all around.
Tell us about bringing this tool to market now. What's the vision for the numbers of people that you can help? What it's going to take to scale this the way you want to?
Yeah.
And people would want to know, okay, what's it going to cost me to use this?
Yeah, great question. So right now, just totally free to use, right? We built it rapidly. We got the cost way, way down. And I'll tell you how kind of claims denials and appeals works right now. If you have your geriatric doctor process a appeal for you, American Hospital Association put out the stat, it's $43.84 of the clinic to eat the cost because they have to put billing staff on it. Provider might have to review, so it costs time, right? And billable hours. So you're competing against something where a lot of these clinics don't want to insert themselves in the workflow, or will do it once in a while as a favor. But they're like, I can't spend $43.84 each time a patient has one, especially if hundreds of these are happening every month. I'll just like go bankrupt as a clinic. So many of the physician practices are not doing it. So the patient's on their own now. So we got the cost down 2 months ago when we first launched our prototype. We got the cost down to less than 12 cents per each appeal. Then these new DeepSeek models came out, which are like way, way cheaper AI. And we've now gotten the cost down to less than 2 cents. It's like bordering like 1.5 cents. And I think we eventually get it down to less than a penny. So when you kind of get the cost, it's almost like a order of magnitude cheaper than anything that is kind of prevailing in the market for like a human billing person to kind of adjudicate and write detailed letters on. And accuracy is sky high. Now you can just say, okay, you know what? Now I'm going to one-click programmatically appeal everything. So for now, there isn't really a need to charge people money. The cost is just very low. I think over time, we'll add ancillary services like sending letters to state insurance regulators, kind of notifying them. Because a lot of times when you appeal, if you also let your state insurance regulator know that I'm appealing, chance of winning is higher. Oftentimes, if you lose the appeal, they'll force it to independent review, and that's external review. You know, the states have committees. So I think that when we build like a whole suite of products like that, some of those we may kind of like monetize on. But right now, it's just like get as many people to use it for free, and then we're in talks with some clinics that are beta testing it right now, to pay for usage because they're realizing not only will it save them a lot of staff time and money, but it might actually result in better revenue collections for them. So it's a really revenue cycle management tool for the clinics that are losing per physician. A lot of the clinics are losing $5,000 to $10,000 per month on denied claims that ultimately aren't paid by the patient. So then the clinic has just like done the care and then isn't going to get paid for it. So it's a real revenue cycle issue for them. But I'd say currently not very focused on kind of like monetizing, just like getting as many people to use it as possible. And I think the medium term thing, I would love in 2025, a shout out on the earnings call saying, I took a $100 million charge this year because Counterforce Health is now processing so many appeals and I'm having to pay them out. That's like kind of the dream that I'm like hoping for because I think these insurers are like, and you can blame them. I guess they're just getting away with it right now because no one's fighting back. So yeah,
Wow.
I'd love to cause losses in insurance companies. That's my goal.
Neal, you're no stranger to coming up with ideas that really shake things up. But let's take a look at a little online spot you put together before the Super Bowl for Care Yaya.
Dementia may have taken her memories, but it couldn't steal her Super Bowl spirit. And she's not alone. Across the country, millions of caregivers are making sure moments like this still happen. They are the MVPs who aren't on the field but show up every single day. They don't wear NFL jerseys, but they make perfect handoffs like a cup of water filled with care. While others call plays on the field, they run their own game plan at home, making crucial assists like an adjusted recliner or favorite snack. Because caregiving is more than tasks. It's teamwork. It's showing up play after play, even when no one is keeping score. This is how over 50 million Americans, the caregivers, loved ones, even the four-legged fans, are watching the Super Bowl this year, not just as spectators, but as teammates. The Super Bowl has a way of bringing generations together, because that thrill of the game, it feels the same whether you're 8 or 80, whether you remember every play or just the feeling it brings. So, here's to all the caregivers making Super Bowl Sunday and every day a win.
Yeah. Patrick Mahomes?
Oh, hell yeah. Mhm, yeah. Yeah.
Lisa, I love you.
So I have to say, I was very excited about this. I was in the middle of the ocean off of Zihuatanejo when I heard about this. It seems to me, Neal, that you really are touching a lot of people. So tell us about how the spot came about and the progress you're making with Care Yaya.
Sure. Yeah. So it was an awesome opportunity where LinkedIn and the NFL reached out to us. And they're reaching out to certain kind of like executive creators, on the platform that are driving a lot of engagement and have a lot of audience. And we've now have over 70,000 followers across kind of like our personal LinkedIn, as well as like adding the company. It's like over 100,000. And then they'd already chosen us as like top 50 startups in America. So I think as a result of that, they were doing a joint promotion with NFL of like, let's build buzz around the game in different ways of like how it relates to, your work and your audience. And in our case, is really awesome where we have so many wonderful families that are getting care people that are enjoying the game. In this case, an amazing lady with pretty advanced like dementia, but still like loves watching the game, knows the players, knows kind of like the plays and the tactics, and one of the student caregivers that's helping her. So, with the family's permission, we were like, hey, can we tape something that's like positive and inspirational to inspire people everywhere that, hey, like NFL is something that can be enjoyed by all generations, whether it's like 80-year-olds or 20-year-olds, actually oftentimes brings people together. So it's like a kind of like heartwarming piece we wanted to put out there. But yeah, with LinkedIn's help, and NFL's help, like we put that out in advance of the game. The thing went viral, had like hundreds of thousands of views. So it's been awesome, like tons of people reposting and engaging on it and building buzz. And I think that it shows kind of like the future of, future of social media and traditional media. I think that 2025, I read a statistic that it's an inflection point where more minutes are going to be spent cumulatively by Americans on social media than traditional media, right? Just given like TV viewership, newspaper, et cetera, is like gradually declining generationally. So a lot of large organizations like like NFL are realizing this is where people are at. So running TV ads to get people to watch our game is sure, that's one thing. Then that's what's been done for the last 20, 30 years. But you now need to kind of run social media, and there it's not just running ads, organic reach. So I think it's awesome where you have like, in our case, through our care service, like we have this huge audience of families using it, students using it, healthcare system participants collaborating with it. And then we can put out something like heartwarming and positive that like, builds awareness for them, builds awareness for us. And then like LinkedIn is kind of like the media platform loves and amplifies. So win-win all around, I'd say.
And about the growth that Mary was asking about of Care Yaya, what can you tell us? Give us the update.
Oh yeah, it's growing really fast. So we are now at almost 30,000 students. We're at pushing on almost 40 universities. We're opening some huge markets. Like obviously San Francisco has been an awesome market for us, but we're now all over New York, all over Boston, parts of Florida, parts of Texas. So it's been really cool. It's like I hope that it goes fully nationwide by the end of this year. Pleased to say we've received backing from a couple of prominent organizations within the caregiving space. So, obviously we received investment from the AARP as well as from the American Heart Association social impact funds. So that's been really cool where like we were like initially just building it with like angels who are mostly like physicians in different healthcare systems, but now like institutional backing. So that's been like an awesome way to start the year. So yeah, super excited. I think this 2025 is going to be an awesome, huge growth year for us.
Well, changing the worlds of caregiving and now the appeals process for health insurance claims. I know many in our audience will want to know where they can go for information and help.
Sure. Yeah. I mean, if anyone is dealing with a denied healthcare claim or is serving people who are dealing with this, please visit us at counterforcehealth.org. So COUNTERFORCE health.org, or just send me a message or DM me on LinkedIn. It's Neal K. Shah at CareYaya/Counterforce. So I'm happy to respond to anyone. We're happy to help people with these tools for free. We're looking for pilots with patient advocacy organizations, caregiver support groups, anyone going through kind of dementia, cancer, autoimmune disease. I mean, the more I've dug into this, each indication, there are just so many people getting denied. So, we'd love to collaborate with like patient advocacy organizations, obviously healthcare systems, independent physicians, small clinics, et cetera. So anyone who is helping people go through this, we're happy to help. But I think that's going to be it's going to be a big issue of our times. And I think the change starts from the bottom. I think that sitting around waiting for the government to deal with this, I think you might as well, wait till you're blue in the face. But I think, and then I also think, kind of some people are getting really angry and like doing violent action. I don't think that's like right approach either. But I can understand why, because the system's so broken. I think actually the middle ground approach is use innovative energy and new technology to kind of build solutions from grassroots. And I think that's how you can solve the problem.
And on Care Yaya, where should folks head?
Sure. There, if you need help with care, you just want to reach out to learn more, people can go to careYaya.org, CareYaya.org. And also, yeah, just hit us up on LinkedIn. We're also pretty active on Instagram and other social media platforms, Facebook, et cetera. So happy to help people.
So I've dedicated my life's work to empowering older adults to give them a voice with technology. And when I just got started and wrote Computers for Kids Over 60, when I was in my 30s, I thought, yes, we need to be empowered with technology. Now I see we need to be empowered with AI and technology. And these can help us solve some of the real problems that we have. So we really need to spread the word. And, one of my investors once said to me, I said, what would I do if I didn't do this? And he said, you would shine a light on people and causes that matter. You today have shone a light on people and causes that matter. I'm so proud to have you on our podcast today, Neal. And congratulations on your work. It's such a narrative we enjoy watching. So thank you again for being with us.
Great. Yeah, thank you, Mary. And thank you, Fred. Really appreciate the opportunity.
Well, Mary, I think we've given everyone a lot to think about when it comes to the roles AI can play when it comes to their lives and healthcare. I'm convinced it really can save your life.
The work that Dr. Rhew and the healthcare partners he's working with, and the work that Neal and his amazing force of CareYayas are really groundbreaking. And remember, everyone, it's Heart Month, and we hope you're all motivated to stay healthy and in love. And speaking of hearts, happy Valentine's Day.
A special thank you to our sponsor for this episode, Rhew, improving the quality of life for older adults and people living with dementia. Find their curated catalog at eugeria.care. We also want to thank Dr. David Rhew from Microsoft and Neal Shah for spending time with us. And we appreciate all of you spending time with us as well. You can always find more and the Longevity Deal Talk podcast too at maryfurlong.com/podcasts.